So you probably know Tadalafil is that pill, but let me hit you with something that most guys have never heard. If you're over 30, the right dose of Tadalafil might not just help you perform, it could help you perform everywhere. We're talking the gym, the office, your mood, your metabolism, even the way your hormones balance out. And no, this isn't some bro science Instagram hack. Imagine a pill so subtle you barely feel it kick in, but behind the scenes, it's improving blood flow, boosting oxygen delivery, fine tuning insulin sensitivity, and maybe, just maybe, nudging your testosterone in the right direction. It's like a quiet background upgrade to your operating system. You don't notice it until you realize your pumps are better, your runs feel smoother, your brain fog isn't there. I'm going to show you exactly how it works, what the science says, and how guys are using it to future-proof their bodies. So if you're curious enough to see why Tadalafil might be the most under-discussed everyday performance enhancer for men over 30, stick with me. So let's zoom out for a second. Tadalafil. Most guys hear it and instantly think erectile dysfunction. And sure, that's the main FDA-approved purpose. But as is often the case in medicine, a drug designed for one thing ends up having effects on all kinds of unexpected places. Think about aspirin. Originally made for pain relief, but now it's used for heart health, or metformin, started as a diabetes drug, now being studied for longevity. Tadalafil falls into the same happy accident category. Here's the big picture. It's a PDE5 inhibitor. That means it helps relax the smooth muscle around your blood vessels by blocking the enzyme that breaks down cyclic GMP, a chemical messenger that signals, hey, it's time to open the pipes. And when your blood vessels open up more, circulation improves everywhere. Better circulation means better oxygen delivery, better nutrient delivery, and even more efficient waste removal from your tissues. That matters in the gym. It matters for recovery. It matters for brain performance. And it's not just theory. We've got studies showing effects on VO2 max, that's your endurance ceiling, insulin sensitivity, your metabolic flexibility, hormone balance, testosterone to estrogen ratios, mood and cognitive clarity. The crazy part, we're talking microdoses here, just 2.5 to 5 milligrams per day. That's not a weekend warrior dose. That's a keep it in the background dose. It's the difference between driving a car with the parking brake slightly on and taking it off. Everything feels smoother. So before you write it off as just for guys who can't get it up, let's look at why biohackers, endurance athletes, and yes, even regular dudes over 30 are quietly adding it to their daily toolkit. All right, so quick science pit stop. You've got an enzyme called phosphodiesterase type 5, PDE5 for short. Its job is to break down cyclic guanosine monophosphate, or cyclic GMP. Cyclic GMP's job? Tell your smooth muscle cells to chill out so your blood vessels can open up. Now, normally cyclic GMP is produced when nitric oxide signals for vasodilation. That's how your body increases blood flow during exercise, arousal, or even when you need to cool off. The problem is, PDE5 comes in like a cleanup crew and sweeps away that cyclic GMP pretty quickly. What Tadalafil does is block PDE5, which means cyclic GMP sticks around longer, which means your blood vessels stay dilated longer. And here's the part most guys don't realize. Smooth muscle isn't just in your reproductive system. It's everywhere in your vascular network, your legs, your arms, your heart, even your brain. So in theory, you're creating a mild, constant state of enhanced circulation throughout your entire body. That's why studies like the 2021 Journal of Clinical Hypertension paper have found that daily low-dose Tadalafil can improve endothelial function in men with cardiovascular risk factors. The endothelium is basically the inner lining of blood vessels. When it's healthier, your circulation works better. Now, why Tadalafil specifically and not Viagra? Two reasons. The first is half-life. Tadalafil lasts about 17.5 hours. That means a steady effect from daily dosing. Viagra's gone in about 4 to 5 hours. And secondly, selectivity. It's a little more selective for PDE5, meaning fewer off-target effects like visual changes. In short, if you're looking for a daily background boost, Tadalafil's pharmacology fits the bill. Think of it like switching your home's plumbing from garden hoses to fire hoses. You're not blasting water constantly, but the capacity is there when you need it. All right, let's talk gym floor. You know that moment in a workout when your muscles feel like they're about to burst? That skin-stretching pump that makes you want to take a quick locker room selfie. Yeah, that's blood. More specifically, blood plasma, nutrients, and oxygen flooding into your muscle cells. Now imagine if your body could hit that state a little easier, a little faster, and hold it a little longer without you redlining. That's where low-dose Tadalafil starts to get interesting for training. A 2017 European Urology randomized control trial looked at men using 5 milligrams daily. While the main goal was ED outcomes, researchers noticed something else, improvements in VO2 max and time to exhaustion. That's endurance capacity, the ceiling for how long and how hard you can push your body before it taps out. And it's not just cardio. A 2020 Frontiers in Physiology pilot study showed men on daily PDE5 inhibitors had measurably better muscle oxygenation during resistance training. That's like having better gas mileage in your workout engine. Now, will Tadalafil suddenly have you curling 60s instead of 40s? No, but here's where the stack effect happens. You train slightly harder, you recover slightly faster, you feel a bit more energy during sessions. Stack those over months, you're adding reps, improving volume, and nudging hypertrophy. And let's not ignore the mental pump. Knowing your circulation is optimized can give you that placebo plus effect. It's not just in your head, but even if it makes you train better, that's still a win. Here's the caveat. You will feel warmer. Vasodilation plus intense training means your body's thermoregulation is on high alert. Stay hydrated. Add electrolytes if you're training longer than an hour. Bottom line, Tadalafil is like swapping your training shoes for a pair that just fits better and grips more. You're still doing the work, but it feels smoother. Now here's where guys with desk jobs and stubborn belly fat need to perk up. Low-dose Tadalafil seems to improve the way your body handles glucose, and that can have a knock-on effect for fat storage and energy levels. Let's start with the 2018 Journal of Clinical Endocrinology and Metabolism study. Researchers gave obese men with metabolic syndrome 5 milligrams of Tadalafil daily for 12 weeks. And what happened? Insulin sensitivity improved significantly. Fasting insulin levels dropped, and triglycerides nudged down as well. Now, if you're not a lab nerd, here's why that matters. When you're insulin resistant, your body shuttles more of what you eat into fat storage, especially visceral fat around the belly. That same resistance keeps you from easily tapping into fat for fuel. It's like your body's stuck in store mode. By improving insulin sensitivity, Tadalafil may help flip that metabolic switch back towards burn mode. No, it's not a fat burner, but it makes your fat loss efforts more efficient. Mechanistically, it makes sense. Better microvascular blood flow means glucose gets delivered to muscle tissue more readily instead of sitting in your blood or getting stored as fat. That's better nutrient partitioning. And this is where it could become a sleeper biohack for weekend warriors. If your nutrition and training are already on point, improved insulin sensitivity means better recovery, less post-meal fatigue, and potentially leaner gains. And there's even early exploration into using PDE5 inhibitors for early stage 2 type diabetes prevention. Still early days, but promising. And one practical note, the metabolic benefits aren't an excuse to hammer pizza or beer every weekend. Think of Tadalafil like premium motor oil. It works best in a well-maintained engine. Now, let's talk about hormones. Some studies show that men on daily Tadalafil see small but real increases in testosterone, plus something arguably more important, a better testosterone to estrogen ratio. In a 2013 andrology study, men took 5 milligrams of Tadalafil daily for 3 months. Their total testosterone went up 10 to 20%. Estradiol didn't climb at the same rate. That means a slight hormonal tilt in favor of androgens. And why? One theory, Tadalafil improves testicular blood flow, making the Leydig cells, those are your testosterone factories, more efficient. And another, better sleep and lower chronic stress load. When your endothelial health improves, your whole body's stress response calms down, which can free up more resources for hormone production. And let's not dance around the obvious. Better erectile function often leads to more sexual activity, which itself has been shown in multiple studies to cause short-term spikes in testosterone. But don't think of it as a testosterone replacement therapy alternative. The changes are modest, more like taking the handbrake off of your natural system. Now, the TDE ratio matters because high estradiol relative to testosterone can make you feel sluggish, kill libido, and promote fat storage, especially in the chest and belly. Even small ratio improvements can change the way you feel day to day. Practical application, if you're already lifting, eating clean, and sleeping decently, daily low-dose Tadalafil might help your hormones run in a younger pattern for longer. Now, last stop before we hit safety, and it's a big one. Blood flow is brain flow. Studies like the 2015 Transitional Psychiatry paper found that men with mild cognitive impairment saw measurable improvements in cognitive performance after daily Tadalafil. We're not talking miracle cures, but small shifts in executive function, memory, and processing speed. The proposed mechanism, increased cerebral perfusion, basically more blood and oxygen and nutrients to the brain. And better brain blood flow doesn't just mean sharper memory. It means better mood, less flatness, and improved mental energy. That could be the difference between finishing your day strong or zoning out at 3 p.m. There's also an interesting vascular longevity angle. PDE5 inhibitors have been shown to reduce arterial stiffness over time. One 2014 Journal of Cardiovascular Pharmacology study saw improved arterial compliance after 6 months of low-dose use. That's literally slowing down part of the vascular aging process. And on the mood front, there's evidence that PDE5s help reduce depressive symptoms in men with ED. Some researchers think it's partially biochemical, not just psychological, due to nitric oxide pathway modulation. Bottom line, Tadalafil isn't just about function. It's about maintaining vascular health head to toe. All right, so quick reality check before you go popping tabs. Daily low-dose Tadalafil, so that's 2.5 to 5 milligrams, is generally safe for most healthy men. Side effects are usually mild and short-lived, things like headaches, mild flushing, indigestion, and backache. These often fade after a week or two as your body adjusts. And lastly, do not combine it with nitrates, things like nitroglycerin or certain alpha blockers. That can cause a dangerous drop in blood pressure. If you're on any heart medication, first get clearance from your doctor. Liver or kidney disease, again, doctor first. And yes, stick to pharmacy-grade generics. No random herbal Cialis from sketchy online sellers. Some guys ask about cycling. It's not necessary for most, but you could run 8 to 12 weeks on, then take a few weeks off if you want to see if you notice the difference. Okay, so let's recap. Number 1, mechanism, PDE5 inhibition, leads to a cyclic GMP boost, which leads to smooth muscle relaxation and ultimately better blood flow everywhere. Secondly, performance, VO2 max goes up, pumps are stronger, and muscle oxygenation is better. Third, metabolism, improved insulin sensitivity and better nutrient partitioning. Fourth, hormones, modest testosterone lift and a better TDE ratio. Fifth, brain and vascular health, increased cerebral perfusion and reduced arterial stiffness. And lastly, safety. Low dose is generally safe, but avoid mixing with certain meds. If you're over 30, training consistently, eating clean, and looking for a subtle but meaningful edge, Tadalafil could be a quiet background upgrade. This isn't about quick fixes. It's about stacking small physiological wins that add up over years. And if this kind of smart, evidence-backed body optimization is your thing, subscribe, hit that like button, and I'll see you in the next one. And as always, I thank you for tuning in. Thank you.